Just reflecting on a couple of key points that have been mentioned, I think one of the things that really jumps out is the role of partnerships in building the architecture for improvement. And the question that was just posed in terms of who are the quality improvers, I think that's something that partnerships can bring to the table, because that nudge, that catalytic role of partnerships shouldn't be underestimated. So this architecture building, and we come back to some of the points that we were mentioning this morning, is that partnerships can be an entry point into a discussion on quality improvement. And that's clearly evident from the discussions this afternoon. The second point that I wanted to make was data really counts. So the excellent presentation from my colleague in Sudan was pinpointing maternal mortality ratio. Now, that's going to get attention from a clinician, and it will get attention from the Minister of Health. And those results, and being frank in this safe space of this community, sometimes partnerships don't go down that pathway and talk numbers. But I think if the partnership movement is going to really blossom, it does need to talk about those numbers. And importantly, not just talk about the change, but also the sustainability of that change. But kudos to the partnership with Sudan for really highlighting those numbers. The third point was this whole question that was posed about what do we mean by partnerships? And there's many ways of looking at this, and ESTHER have done some really impressive work on this subject. ESTHER has done some equally important work in this. But going beyond the actual words and thinking about what those words mean in the context of an individual partnership. So using that wisdom that's been collated by different organizations, but also placing a challenge on each partnership to define the principles upon which that partnership will live. And again, here is another area which is complex methodologically, but how do you measure the strength of a partnership? That's another area that might be looked at. The point about linking the partnership work with the leadership of national authorities came across very strongly in all the presentations, but particularly from the experience in Mozambique. It was very clear that the strength of the partnership comes from multiple entry points. And this is again the point that we were making this morning: national directions, partnership-based approaches, bottom up, top down. And then just the final thing that just grabbed my attention is the concept of nested partnerships. So really thinking about this partnership between an Irish institution and an institution in another country, but never forgetting that those institutions actually sit within a potential partnership with communities, potential partnerships with other NGOs, and also potential partnerships with other institutional health partnerships. So for example, just think about a hospital in one of the countries that we've spoken about. We know that there are partnerships that are blossoming with Germany, blossoming with France. How do these partnerships link up? But the concept of a nested partnership, really focusing in on the community, is particularly important as we move into this work on universal health coverage. And this is my final point: packages of services that are delivered in hospitals or districts. That's something that partnerships need to consider, because the work of a partnership has to consider the local context and the local health environment within which it's operating. So just a few thoughts, Philip.